So without further ado, I would like to turn the floor over to our first presenter, Arielle, dental health aide therapist serving the Southeast Alaska. And I apologize. I did not realize I was not recording. I apologize. So, again, just to make this announcement, this session is being recorded. The recording will be posted to YouTube. Once that recording has been uploaded, I will send an email to all registrants with the recording to the webinar as well as the presentation slides and the evaluation survey for anyone that needs to drop off early. But I turn it over.
Thank you, Dree, for that introduction. My name is Arielle Cawston. I'm a Caldwell Confederated Tribal member, and I work here in Southeast Alaska, as Dree said. I'm excited to be here to talk about these systemic connections because they're often, I don't want to say overlooked, but not on the forefront of our minds. When we think about systemic connection and oral health, we often think about as our oral health being the window to our bodies. So when we have patients that have high blood pressure, diabetes, those are directly connected to their oral health and their gum disease. If they go and they're getting one treated but not the other, they're going to continue to have problems. So if we have somebody who has high blood pressure and maybe they are seeking medical attention, but they're not getting regular dental care, they're going to continue to have high blood pressure issues. If we have somebody who's getting dental care and maybe we see them with elevated blood pressures, but they're not seeking medical intervention, then they're going to continue to have dental health issues. And vice versa, that goes connected with diabetes as well. When we look at historical photos of Native communities and Alaska Native communities or Indigenous populations, we see healthy, happy, full dentition smiles from 150 years ago. So what changed? What happened from now to 150 years ago that we don't see that happening in our communities now? As Drew mentioned, we have some of the highest oral health disease per capita in our populations and tribal communities. One of the changes that we see is dietary changes. When we look at those historical photographs, we see people who were living a subsistence lifestyle. They were living off the land. When we talk about what causes cavities and bacteria or cavities and periodontal disease, that's multifactorial. Specifically talking about cavities, you need to have the cariogenic bacteria, plus you need to be feeding that cariogenic bacteria with a cariogenic food or food that feeds it. That will create an acid, and the acid is then going to attack the teeth. When we think of a subsistence lifestyle, that wasn't the food that feeds the bacteria was not in our traditional foods. Here in Alaska, many years ago, before DHATs were practicing, villages were based on visiting setup systems. So a dentist would come in, evaluate the village, see the village, be there for a week or 2 weeks at a time, and then he would have a system. XYZ means we need to come back in XYZ amount of time. He had visited a village, or there's a situation where we had a dentist visit a village, and in that village, they were living a subsistence lifestyle at the time. And in that dental visit, there was very low carious situations present in the community's oral health. And so based off of that system, XYZ, the dentist had assigned that this village didn't need another visit for another 18 months. In that 18 months, the village introduced a store that then had processed food diets. In the time that the next dentist came 18 months later, almost every patient that they saw had cavities. And he thought, wow, what was this dentist thinking? He called the dentist and he said, hey, What were you thinking putting this village on an 18-month recall? Everybody here has a cavity that I've seen. They needed to be seen, way sooner than this. And the dentist thought, well, based off of what I saw when I was there, that wasn't the case. The introduction of the processed food introduced the food that feeds the carious bacteria and creates the acid that then attacks the teeth. So the carious bacteria was present, but they weren't feeding it with the food that causes the acid. So after this 18-month recall and introducing those processed foods, there was a forever change to that village's oral health status. And where do we go from there with our patients? What can we do now? We're not going to take away the store. The store is going to be there probably forever. If not, more stores are going to come. More introductions are going to come. More infrastructure is going to come. The village is going to expand. Patients are now going to eat these foods. They're easily accessible, relatively inexpensive, tasty. We have to change how we're communicating with our patients. We have to increase their dental knowledge and literacy so that they understand the change that has happened is because now our diets have changed. And we have to address that in conversation and education. A few ways that we're doing that here in Southeast Alaska, in the village that I'm serving, is we do educational programs in our schools. I go once a week to our Head Start, and we not only brush and take care of our teeth, but we read a book called Sugarbug Doug. And Sugarbug Doug is a great pictorial book that shows kids and tells a story about the sugar bugs that live in our mouth. It educates them on diet, and it educates them on this tooth structure and how to take care of it. There's 2 pages in the book that talk about diet. One is about unhealthy foods, and one is about healthy foods. And the unhealthy food page comes first. And I always stop on that page and we have a discussion with the kids. And I ask them, what's your favorite food on this page? And on the page, you have cookies and candy and popsicles and soda and crackers. Crackers cause cavities. That's not a message that's said enough. And so the kids will all raise their hand and they'll tell me what their favorite food is. And I share them with my favorite food is. And then I ask them, can we eat these foods? And the answer is yes, because we're going to. These foods are now part of our systemic life, part of our routine life. And kids are going to eat them, whether it be on holidays or whether it be regularly. The conversation piece then is, what do we do if we choose to eat these foods? How are we going to take care of our teeth? And if you asked any one of my Head Start kids today, and I've been with them now for a year, some of them on year 2, they will tell you, I could brush my teeth, Miss Arielle. And if you ask them, well, what if you don't have your toothbrush? Then what could you do? They will tell you, I could drink water or eat an apple. Apples are abrasive. They're going to remove some of those sugary carbohydrates that feed the cariogenic bacteria that causes cavities. Water is going to help wash off any excess food remaining. These are such important conversations for our kids. The book then goes on to talk about, we brush, and then why do we floss? We floss because Sugarbug Doug's going to run and hide in between our teeth. And when I brush the kids' teeth and we pull the floss out, we hold the floss up, and they see those little tiny sugar bugs hanging out in between their teeth, it then builds a relationship and the mentality that this is something that I have to do daily. These visits at the school aren't only helping educate our youth, but they're helping heal historical trauma. Historical trauma, we know, is embedded in our DNA. So whether we are talking about it or not, we feel it. There is a particular heavy historical trauma within the dental division. There's a show called Molly of Denali, and it's a PBS kids show. And they have an episode where the dentist flies in on a little tiny airplane. in the village, and the kids get scared. And if you talk to any of my elders in the community that I'm in now, they remember that dentist flying in, and they remember being in a hallway waiting for their turn, and the dentist would open the door, and they describe them as wearing bloody robes, bloody aprons, after seeing the patient before them. Those are very sad truths to living in rural communities when dental care was only every few months or every 18 months, depending on where you fell in the schedule. Going to the schools helps heal that, because when grandparents and parents hear their kids come home and say, Miss Arielle came to school today and she brushed my teeth and I got to floss my teeth because I need to get sugar bugs dug out, we are now seeing elders and adult patients that historically did not come to the clinic routinely and regularly for care, coming and making appointments, coming and trusting the care that they're seeing, because if their grandchildren and their children trust me, then they're more able to trust me. And when they come to the clinic, it opens the opportunity for us to talk again about those connections with our oral health and our systemic health. A few things that we talk about based off of where we see, we've already mentioned high blood pressure, diabetes, but if we have a patient that's pregnant, we want to make sure that mom is having regular routine care, because a healthy mom is going to equal healthy baby. And in those cases, cavities and high blood pressure are some of the concerns we have, but we also have concerns of preeclampsia or diabetes during pregnancy, that we want to make sure mom's going to have the healthiest pregnancy, because healthy mom's going to be a healthy baby. Another benefit of having a dental therapist having these conversations with patients is we get to be a conduit to many other relationships. I am very fortunate here. I get to work with a pediatric team, a general dentist team, and a prosthodontist team. When we get our patients cavity free and there's care that's needed outside of my scope, then we can bridge the patients to that care. When those visiting providers come, we get to also bridge that friendship and that trusted care to the patients. We get to tell them, hey, my friend is coming in, and I would like to be able to introduce you to her so that she can help you. Now that we've gotten you all of your fillings taken care of, we can get you a bridge started, or we can get you into a denture. In addition, we work with our medical team who helps introduce patients to dental. Maybe they are seeking regular medical care because they know they have high blood pressure, they know they have diabetes, or obviously they know they might be pregnant, or they are pregnant and they're seeking pregnancy care. The medical providers can come over and say, hey, we need you to go see dental because this is important that you have regular routine care as well. Going back to our conversation about diets with our patients, if a patient is living a subsistence life, or maybe the conversations that we have led to them living a subsistence life, then we can have a conversation about, okay, what are we eating? Do we still need to brush? The answer of that is going to be yes. So we still do see patients that come in that maybe do live a more subsistence life, or aren't eating candy and drinking soda, but maybe they do eat or snack on crackers. We have those conversations about what are we going to do after that, and how brushing twice a day is a message that we've said for many years, but connecting those other pieces, it's that next level of education to the patient. It's not just brushing, it's not just flossing, it's making sure you have a healthy diet that sustains healthy teeth. I see a comment and I can't ignore it, so I'm going to read it here. It says, your words are hard to hear because I'm a Native elder and I remember these things, but speaking this truth is difficult also. Thank you for your courage. Miigwech. Thank you for sharing that, Paula. that leads to me ending my conversation with you today on when I was in dental school, I called back home to one of my elders and I asked her, what's important to you for me being in school? What is something that you want me to take away and bring back home? And she told me, I don't want you to forget our elders. So as important as it is for us to have that connection with our pediatric care, I never want to forget our elders. I jokingly say to my other provider team, I work gum to gum, because we also have those conversations with our elders. If they're in full dentition and healthy, I want to know why. I want to know their diet. Maybe they grew up living a subsistence diet. If they're not and they have other help that they need from me, I want to also help them with those connections. So a patient that goes into dentures is going to have a full lifestyle change in their dietary restrictions. They're not going to be able to bite into a corn on the cob the same way that they did when they were a kid. They're not going to eat a big bite of juicy steak. They might have to cut it thinner. And those are conversations that we have to help in anticipatory guidance and making sure that they know how those changes are going to impact them. Because when we want everybody to love their smile, we want all of our people to be proud of our smile. And I know they want that too. And when they have that guidance, it just supports them to being healthier and happier, which is another conversation, maybe not for today, about how our oral health impacts our mental health. Having a confident smile builds confident individuals. I really appreciate being here today. I'm happy to answer any questions that anybody has. Thank you. And y'all. Miigwech and Gunesh Jish.
So, do we have any questions really quick before we go to the next presenter? I want to make sure if there's any comments or questions that are immediate that we address those before we transition. And then we're going to come back at the end for a big Q&A, but I just wanted to give time. So, Kari, you can put up your slides while Luke asks his question. Go ahead, Luke. Um,
Luke, were you going to verbally ask your question or put it in the chat?
Oh, they are on mute. They cannot ask the questions. Okay, would you like to put it in the chat box? Thank you, Lacey. I keep forgetting this is a webinar and not a regular Zoom meeting.
For the sake of time, would you like me to get started and then we can come back to the questions? Is that okay? Or I can wait.
Um, Luke, did you want to type it? Can you speak now?
He has his question up. He
Oh,
says, so I work with patients with anxiety and would like to be culturally sensitive. Or what would be a culturally sensitive way to bring up past trauma? Luke, I think that's a great question. Every provider is going to have a little bit of different way of how they are able to bring this. Of course, we got to be able to read the room and what our patients are ready to hear. With my patients, I honestly address it directly. as a dental therapist, we get a little bit more time with our patients to have these conversations. I sit my patients up and I face them and I talk to them and I ask them, in the past, have you had dental trauma? Or is there anything about the dental office that makes you nervous? Let's talk about that so we can break down some of these walls and I can kind of guide you in what I'm going to be doing. And I also ask them how they like to be guided. Some of our patients don't want to know. They know they're going to get something done, but they don't want you to talk about it. They just want to get it done and over with. Some of our patients want step by step. Okay, now I'm going to put some jelly on your gums. Now we're going to do this. Now we're going to do that. And that helps them ease, oh, we're about halfway through. Ask them how they like to be guided. Some patients, and I found this out afterwards, completely shut down, that will agree with you the entire time that you're there. And then when they walk out of the office, they forget. So I often let them know, if you leave here, you feel the conversation wasn't addressed or you don't remember our conversation, don't hesitate to call back and ask questions. But yeah, I would say culturally, I just have that very respectful conversation where I sit them up and I ask them directly, and if they're ready or comfortable to talk about it. I hope that helps.
And then you had another quick question from Brian. Are you currently applying fluoride varnish every 3 months in clinical and home settings?
Yes, I do. Okay, so fluoride varnish, yes, I apply it at least every 3 months, both clinically. I have gone to our in-home daycares and I apply it at Head Start. If I have a patient that might need it for other various reasons more than 3 months, we will have that discussion with them. We have a lot of motivational conversations with our patients too, that it's not just what we do in the dental clinic that is going to support you from having healthy teeth. It's what you're doing at home too. We have to be a team for this to be successful. Oh, trauma-informed dental screening surveys are amazing. I love that, Luke. I think they're a great way to kind of get a baseline of where your patients are at. We have that as well at my office. And there's a section in there that mentions, are you a touchy-feely person, so that I can then have those conversations before I set them back and make sure they're comfortable with, because of course in dental care, we have to touch and feel our patients for various reasons. So we want to make sure they're comfortable with that. I think there's a few resources that you might have available to you. One of them would be the motivational interviewing through IHS. They have a great book that helps you with those conversations to your patients.
And then one last question before we moved on. Ms. Kimberly asks, how do we access the trauma-informed dental screening survey?
My understanding is Luke is creating a survey for his patients. I don't know if but I'm sure if we typed that into Google, we'd find some resources available to us. But I think there are information out there to help, and you just put it in with your patient's health history form so that you get a little bit more window of what their experience was in the past.
All right. All right, so thank you for that. And thank you for your patience, Luke. Thank you. Thank you. So now we would now move forward. You can now share screen. Please stay, Arielle, if you're able, just in case they have more questions, you
Absolutely.
can. Okay,
Yep.
thank you. Thank you. All right. And then now we're turning over to Miss Kari Ann. Kari Ann.
No worries. Thank you so much. And thank you, Arielle, for your experience and for sharing with everyone. And I want to add in a happy birthday to you as well. Today's Arielle's birthday. It's really great to have her on here with us today. Well, I think that my introduction, part of it was given earlier, so I don't want to spend too much time doing that again. But again, I'm Kari Ann Kuntzelman and a member of the Chickasaw Nation of Oklahoma, and I'm going to talk with you all today about dental therapy. I'm gonna go ahead and move on here. So, how I got to be in this space with you all is I attended the Alaska Dental Therapy Education Program and was part of the 2019 graduation class. You'll see here that on the upper left photo, Arielle Cawston was also in my class as well. I wanted to share these pictures with you all so you could have a little bit of an idea of who I am and how I got into dental therapy and what made me excited about dental therapy. So I'm the oldest of five. I grew up all over the United States. When I was a kid, I also lived outside of, I lived in Brussels, Belgium for a short period of time. I don't always share that piece, but how I got into dentistry is when I was growing up, I had some dental issues myself. I had a supernumerary tooth or extra tooth growing from the roof of my mouth that I had to have some oral surgery to have removed. And contrary to what others say or what I hear others say sometimes is that I got into dentistry because I had some personal things going on at home, and I really felt that being at the dental clinic for some weird reason really helped me to really to kind of find myself. And I felt like that was a place that I was comfortable and people listened to me. And so that's really how I found an interest in dentistry. Again, I grew up moving around a lot as a kid. I didn't know that I was Native until I was a little bit older. So because my grandmother, I'm Native on my grandmother's side, and when she was growing up, it wasn't okay to talk about being Native. She really had to keep that to herself to avoid going to boarding schools, which many of our grandmothers and grandfathers and brothers and sisters had to experience that and endure that. So when I was in my early to mid 20s is when I had found out that I was an enrolled member of the Chickasaw Nation of Oklahoma. And at that point, I'd been going to community college for close to 4 years and working on and off. I just really felt like, it was really a struggle for me moving around a lot. And I was the first of five to graduate from high school, let alone or I'm sorry, I was the first of five in my family, in my immediate family to graduate high school, let alone to go on and earn a degree and to find a career that I really was very passionate about. So I wanted to sort of share that piece with you because I think it's important to understand and to look at dental therapy from all sides. There really is, and I know we're going to kind of get into in just a minute, like what is a dental therapist? Because I realize there may be some on this call today that have maybe never heard of dental therapy. But I wanted to just sort of start out with connecting who I am as a person, and I love that Arielle really talked a lot about about her community and where she's at now, so you can really connect with dental therapists as people before we get into what dental therapists do. So very quickly, I think that Arielle had touched a little bit on this, but barriers for American Indian, Alaska Native communities. Very quickly, there are many barriers that exist, much due to colonization and to the existing historical and systemic inequities that link to structural and systemic racism. And so I don't think we need to spend too much time on that because we did hear a little bit about that already. Um, I wanted to just briefly share some data from the data brief from IHS from 2022. And on the left side here, I have another study that I'll talk about a little bit later during my time with you all. But this really is just to show you that data today in 2026 is still very relevant to what it was after colonization. And so, but what I mean by that is that, like we heard at the beginning of this session, that American Indian and Alaska Natives still experience today the highest rate of tooth decay. And the reason why I have this study here on the left is because this study here, along with many other studies, show that dental therapists help to reduce the rates of cavities for American Indian and Alaska Native communities. And so I wanted you to sort of have that in the back of your mind, that is a really great thing about dental therapists, that there are studies that show that they have reduced the rate of caries disease for American Indian and Alaska Native communities. So dental therapy is not new globally, but we still hear today that it's newer to the United States. In the early 2000s is when dental therapy was first introduced within tribal communities in Alaska in the United States. But previous to that, dental therapy existed in New Zealand and many other countries around the world. Now, globally, for over 100 years, dental therapy has existed. Dental therapy in the U.S. Started again in tribal communities in Alaska because they saw that there was a real need. There was a really high rate of decay, and then it was really hard to get providers out to the communities to provide culturally responsible or culturally sensitive care. And then to that, the idea around the dental therapy education program was taking community members that lived within the communities to send them to get trained and then go back to be the ones to provide care in those communities. Later, there are other states that then look to dental therapy for other communities, and there are now other routes to becoming dental therapists that then were adopted and developed after the Alaska Dental Therapy Education Program. I have this picture here on the right, which is just a snippet photo of a study that was done in collaboration with National Indian Health Board, CareQuest Institute for Oral Health, and a few other organizations. I know the Society of American Indian Dentists participated in this as well, but it's just a really great resource for you all to explore after the call. And it really talks about and highlights AI and oral health status. And so I hope you all get some time to take a look at that. So what is a dental therapist? So for some of you that have never heard of dental therapists before today, now we're going to talk about that. So dental therapists are oral healthcare providers, very similar to physician assistants in medicine, but for dentistry. Dental therapists in general focus on prevention and routine restorative care with an emphasis on prevention. Dental therapists work as part of a team-based care model. So dental therapists the intention is never to replace any existing provider type, but to be in addition to and to help create more access to care. Dental therapists really help to, in the studies show that dental therapists expand a reach of dental care, they reduce wait times, and dental therapists are, within dental therapy education, they receive a lot of culturally relevant training as well. This infographic that I have here on the right is an infographic not put together by the American Dental Therapy Association, but our friends at the Native Oral Health Network and Southern Plains Tribal Indian Health Board. So this is just a small list of the procedures or scope of practice that dental therapists are trained in. One of the biggest things I think to note is that dental therapists are trained to diagnose and treat decay. That's something that is a little bit different than or other oral healthcare provider types. But again, dental therapists are generally, in general, trained to really focus on that, on prevention. So the American Dental Therapy Association is a co-chair or friends of the National Partnership for Dental Therapy. And I wanted to just share this resource with you all. You can find it at the website here, and I know that that we'll share these slides with you after, but this was just a pretty comprehensive list of the current dental therapy scope of practice by state. And then there is also one on this resource as well, that is a dental therapy state law comparison. So right now, dental therapy is authorized in legislation is passed in 14 states, but it's different in every state. So this graph here just really helps depending on where you are. If you're interested in exploring or learning more about dental therapy, this chart might be helpful for you. Okay, so dental therapy in the world globally is not new. It's been around for over 100 years, but there in the United States, dental therapy has taken some time to progress and to move forward due to the historical opposition of organized dentistry or the American Dental Association and state dental associations. To that, I think that from my take on the oral healthcare status in general across our country is that it's really important to look at what the need is and what the need of our communities are. And I really wanted to just take this opportunity to share some of some of my favorite studies and research that are out there related to dental therapy, because I think that at the end of the day, all oral healthcare providers really want to provide care needed for our communities. And so I hope you get some time to take a look at these resources here. All right. Right now, there are 7 active dental therapy education programs in the United States. There are 2 dental therapy programs that just received CODA accreditation. One is located in Wisconsin and one is in Oregon. There are I'm going to say well, there's really 3 routes to becoming a dental therapist. So the first route was the one that I went through in Arielle. It is 3, I'm so sorry. It is 3 academic years consolidated into 2 calendar years. And then there are additional education pathways to becoming a dental therapist. So there are programs in Minnesota where you can go to school to become a hygienist and a dental therapist at the same time. And then there are expanded scope programs where if you're an existing dental hygienist, then you can do a little bit more training to then become a dental therapist and be able to expand your scope of practice. I know there are multiple states and programs right now that are looking at ways to help expand practice for hygienists and also to look at routes for education programs to be adopted within community colleges as well. So keep a lookout for more dental therapy education programs. This is my last slide for you all, and then I think we'll have some time for Q&A. But the American Dental Therapy Association is getting ready to launch our updated website. So I think you can expect to see that in the next couple of weeks, but you can become a member of the American Dental Therapy Association if you're interested in learning more about dental therapy or supporting dental therapy. You don't have to be a dental therapist to become a member. We do offer membership to non-dental therapists. Dental therapy students are always complimentary, and we also have organizational memberships as well. If you're interested in learning more about dental therapy through the Community Health Aide program or through a Community Health Aide program certification, there is the National CHAP Symposium happening next month in Billings, Montana, May 5th through 7th. And there is complimentary registration, and some meals are going to be provided as well. On the flyer on the top right of this slide, I hope you're able to scan that little QR code where it says register. If not, I can share that information later. But we also are in the process of releasing our official save the date. So this group here are the first to officially hear that we have signed the contract for our ADTA annual conference to take place in Detroit, Michigan, August 10th through 12th at the Westin. That QR code at the bottom right there will provide you a listserv link to sign up to stay up to date there. And then if you are interested in becoming more involved with dental therapy too, the National Partnership for Dental Therapy is a great resource to stay involved in. That's all that I have for everyone today, but I'm happy to answer any questions or to go into more detail about anything that I went over.
Yes, ma'am. So the first question that we have in the chat box is, what is the difference between a dental hygienist versus therapist?
Sure. So dental hygienists and dental therapists, there's a lot of differences and a lot of similarities. Dental therapists are, again, the biggest difference I think is what I had mentioned around the scope of practice that dental therapists are trained to diagnose and to diagnose decay and to treat decay. I think the education requirements are different, but again, that's I don't know if we have time for that conversation. But there are similarities and differences, but at the end of the day, both provider types are are very valuable and very much needed. And so yeah, I hope that's answers your question. It probably doesn't. I'm sorry.
And so I just want to mention while you was speaking and you was giving the background and showing the charts and the graphs, there was dialogue in the chat among attendees that noted that there is a dental crisis in Indian country. But one comment that come up, and I just want to give you the opportunity to speak on it, is the resistance from dentists and doctors about systemic connections. Is that something that you have heard or something that you experienced while you was in the DHAP program? And you are Arielle, because you're current Arielle, would either one of you like to speak to that?
Well, first, I'm sad that that's happening to you, Valerie. The I do face that at times in my organization as well. Not so much from my dentist. Sometimes I'll send them over, maybe I'll have a patient that has blood pressure regularly, 180 over 106, and I'll send them to medical. And some of my medical providers might tell me like, oh no, we got that down in 2 hours. They don't have high blood pressure. Or I've had it in the past too, where they tell me, oh, well, what do you want us to do? That, we did talk to them. They're drinking Red Bulls and coffees and maybe having alcoholic beverages in the evening. And they'll ask me that. And then I have to have that guided conversation with our medical providers that we need to have a discussion then about the choices that we're making and how that impacts our systemic health. If you're still facing that, I don't know how comfortable you are as a provider. I feel like 34 years probably pretty comfortable saying, to your patient that they're always welcome to get a second opinion. Or you can guide them to doing some of their own research, and then that they can either ask their dentist about that, or they could ask their medical provider about that. But yeah, that's very unfortunate. I'm sorry that that's your experience. And I saw Paula said we do need more providers, more of our people going into dental care. Absolutely, 100%. I think that's another thing that Kari and I both agree on, being in either in where Kari's role is now or where my role is now, showing young people a familiar face that they can do this too. When we were in school, we met with a psychologist that was from Kodiak, I believe, and she was Alaska Native, and she said, nobody ever told me I could be a doctor. So I never thought I could be a doctor. And she made the reference that Native people sometimes need to be told that very directly. You can be a doctor. Telling that to our youth is so impactful. That gives them a different direction or another direction. They don't have to be a doctor. There's also, we talk about, we have a VHOP program here in Alaska where our youth get to go to the clinics, both in the village clinic and in our bigger hospitals, and look at different career opportunities working in the medical field. And we talk a lot that there's a lot of support systems that aren't just provider help that we need. We need infrastructural help, such as facilities and maintenance. We need so if you're good at fixing things, that's a great path for you, and still be able to work in healthcare. We need IT is huge. We need strong IT professionals So there are ways for our young people to work in the medical or dental world that isn't necessarily as a provider if they're not comfortable being in somebody's mouth or working with somebody's body. There are other ways that they can be successful in those career paths.
And
Sure.
so
Sorry, Drea, I was just going to
there,
ask if Kari wanted to add to that.
right. I was just about to ask her, did she want to like add? And if so, Carrie, I had another question that was sent to me for you.
Sure. Yeah, I think I can take the next question. I don't have anything to add. Thank you for answering that one, Arielle.
So this one's about what strategies are being implemented to address the rising costs of dental treatments and make them more affordable. This was a question that was asked when they registered. So
Sure. Yeah, it's a really tough one to answer right now, but I think that my best answer is exactly what we're doing right now. I think that in the world of oral health in general, it's really challenging because like what Ariel just got into, there's still this division between like medical and oral health when it really should be together in sync. And there's a lot of there's a lot of work and a lot of people individually and organizations that are working on like medical dental integration and like what does the action of that mean? You know, there's been so much conversation for a few years that I've really been looped into around medical dental integration, but like how do we make that happen? And I think that that in itself, like looking at the whole body is really going to be the way to help reduce those costs because right now, unfortunately, it almost feels like in the United States, you know, looking at the cost and what the system pays for, it's almost like you're rewarded when you're sick and you're not rewarded for not getting sick, if that makes sense. So I think like really focusing on that prevention piece, and that's the great thing about dental therapy education is, and that's not to say that it's not emphasized in other oral health care provider educations. I'm just not up to speed with the other education for the other provider types, but for dental therapy, I know, like Ariel had mentioned at the beginning of the call, that dental therapists, when working clinically, really do have a little bit more time to spend with patients. And so you're really able to focus on like the motivational interviewing and goal setting and all of those things that Ariel really talked about. So I think that at the end of the day, prevention, focusing on prevention, is the answer to helping reduce those costs because you know we can only do so much from our end here. The pay system is a whole nother thing, I think. And
okay,
then
and just to acknowledge a comment by Brian in the chat, he talks about better health do starts in your mouth and in your home. So backing you all up on the prevention. And he mentioned the company Tooth. It's a woman-owned Native American toothbrush manufacturer. Um, and so that was that. But to like give everyone checking the Q&A, both of the both were excellent presentations with wonderful resources. Could you re-show the slide or post in the chat the website for seeing the scope of practice info for the different states?
Yes, Brian, to answer your question, he asked, can you advance to dental therapy with a 2-year AS dental hygiene degree? Kari will have more information on that. But yes, a dental hygienist can go on to become a dental therapist.
you can, but when you use the word the term advanced, there's no like advanced standing. If that's what you mean, there is still additional training that that would have to be done. There's no like existing pathways to like take a test and then become a dental therapist if you're already an existing hygienist, if that's what you mean. But there are programs, there are two programs in Minnesota that that you can be an existing hygienist and then you apply for their program and then you would then earn either a bachelor's or master's degree in dental therapy. I'll put the link in the chat to the chart.
And then just to reiterate, I will be sending out the link to the book that Arielle referenced during her presentation. I also wrote down the note about the survey. Luke will ask me if he could email me that trauma-informed dental screening survey. I will note his working document. Note it is a working document, but then I will also include some resources that are reliable resources that I find online. I will also include today's presentation and today's recording. And then the link to the state comparison has just been uploaded to the chart. So I have all of those notes. They will be in that follow-up email. So it is 5:01, but I want to make sure that all of your immediate questions were answered. And if you have anything to follow up, please let me know. And I will make sure that our speakers, our presenters get to them. And fingers crossed, hopefully you will see them at this year's National Travel Health Conference. And if not, you can see them in August in Detroit, the week of August the 10th.
10th through 12th, yes.
You can
You
see
just go
them in
right from
Detroit.
Detroit to Phoenix. Pack your
And
sweater
all of those
and your
dates
tank top.
So please let us know what resources you need in the evaluation. If you need a follow-up call, let us know what you need so that we can make sure you get access to those resources. And so they are saying a whole lot of thank yous in the chat. If we was on an old-fashioned meeting invite, I would say use those emojis to show our presenters we thank them. So
well,
most
thank you guys
importantly,
for all
happy
being here.
birthday.
Yeah. Oh, thank you.
Thank you for joining us on your special day that the Creator
I
saw
couldn't
fit for
imagine
you to
spending
be
my day
here.
any better than to be here and share this. Definitely a passion for both Kari and I, and I'm just very grateful that everybody gave us their time today.
Yes. And so thank you again. Those resources, all of the extras, I will be including it in the PowerPoint and sharing out the recording, the slides, and all the additional resources, including their upcoming conference in August in Detroit. So thank you all. Have a blessed Thursday. Drink your water, smile, love on yourself, love on someone else, and go out and just enjoy the day. Thank you all. Bye-bye.